Hi, welcome to the supine head, neck, and shoulder techniques for your polarity class. Um, First, I wanted to just do a little reminder about the three types of touch in polarity therapy: tamasic, rajasic, and sattvic. Tamasic refers to the pressure being deeper, and it's a gentle, firm, but deep pressure. That is combined with the rajasic, which is movement and stretching. It's usually, there's a lot of rocking, and it help free up the energy and get things flowing. Then we have sattvic touch, which is a very light connection with the energy. It's like having a little butterfly land on you, so there is no pressure. There's no, you're not pushing the energy in. I'm not leaning in. I have no weight on my fingers. And you're not trying to compress the energy, or trying to feel the energy and allow it to expand. And when that starts to happen, this is the on the body sattvic. And then off the body sattvic, it starts to expand, and you can take your hands off the body and feel for the energy expanding and into your hand. And sometimes you really feel it stop. Like right now, it doesn't want to go any further. So I stay with it and wait till it expands again, and then I could just draw my hand away. So those are the three forms of touch. In polarity therapy, also a reminder, when you find a tender spot or pain or soreness or tightness, usually when we find that when we're doing rajasic, tamasic work, then you can stop, feel for energy with a sattvic touch, hang out there for a while with the sattvic touch, and then do it off the body, on the body first, and then off the body. And then go back and check your spot. So take note of the spot that had the tenderness or the area. Go back and check if there's a change. You can also then repeat it again. And so that's how, in polarity therapy, in a general sense, one would respond to painful areas. There are many other things you can do, but it's rather than like in trigger point therapy, you'd go into the point and give it deeper, or what in polarity would be a tamasic touch. Instead in polarity, you give it a sattvic touch. Okay, we will start our techniques with the cradle. Your fingertips will be in a sattvic touch. The thumbs will rest just beside and above the ears. Your pointer finger will rest over the carotid artery, and the other fingers will just rest wherever they land. And I'm just going to hold this sattvic sattvic touch, and just feel for energy and connect with my client. And I take my hands off the body and feel for energy as I'm releasing. The second technique is called the cradle, and our fingertips will go underneath, the tips and pads of the fingertips will go just under the upper part of the occipital ridge, and then you'll lean forward and it will push up, and so it'll lift the chin a little bit, and the head will tip back a little bit. And then you lean back and pull, traction a little bit, pull on the occiput, and then repeat by leaning forward, so it will rock the head. And the fingertips face forward, not going in towards the spine, but face straight ahead forward, and they'll be between, between the ears and the spine. You're on either side of the occiput. And so I'm going to go under the head. So that's the rhythmic pump. and that gets the energy moving. Next, we have the occipital and the orbital ridge holds. My 4 fingers will go just along the bottom edge of the occiput. And then on the opposite side, my fingertips will go on the orbital ridge. So that's like right on the eyebrow. Again, with a sattvic feather touch. And I'm connecting diagonal energy through the head and the whole body. And then I slowly release and feel for energy. The second one is going to be very similar. I'm going to use my middle finger underneath on the occiput and which will be it's called the fire finger because there are 5 elements on the finger. So the middle finger is the fire finger. So the fire finger goes below on the occiput, and the air finger, my pointer finger, will go on the orbital ridge, on the eyebrow ridge. And this will be on the same side. So the previous one we did the opposite sides. This is the same side. This will be connecting the 5 vertical lines. We're going to only do 3 spots. You can do 5. So my first one will be close to the spine on the occipital ridge, and the first one on the top will be close to the nose on the orbital ridge. And again, I'm feeling for energy with a butterfly light touch. And then I would release that, draw away, and then I'm going to do 3 spots. I'll do one in the middle of the eyebrow and in the middle of the occipital ridge. And I would be usually sitting closer, but I want you to be able to see where I am, so I'm kind of pulled over to the side. And sometimes if you feel a swirly or a movement, it could be the person unwinding inside. I'm going to shift my chair. This is how I would really be sitting for this. So now you might not be able to see as well. And then you would repeat that to the other side, going on the 4 fingers on the occipital ridge, 4 fingers on the orbital ridge, on the diagonal energy currents, and then I would do fire finger, middle finger on the occipital ridge below. On the same side, I would do the pointer finger in the eyebrow orbital ridge and do 1, 2, 3 on the same side. You can also do the fingers individually on the opposite sides like we did the first technique with all 4 fingers, but I didn't want to repeat. It would be the same effect. You would just be doing them one at a time. Okay. So the head techniques, all the techniques in the head, address balancing the fire oval field. You can look at the charts in the handouts just to see. That's just for your information. Next, we will go and do the posterior neck, and this would address the ether oval field. So I'm not turning the head all the way to do the technique. I'm just going to show you. We start at the base of the neck. You use your fire finger. You can support it with your pointer finger. And we're going to do, you can do, depending on your person's pressure, preference, or what it feels right to you to use, you can do a light pressure or medium pressure. We're going to do circles, but going up the back of the neck. maybe 3, 4, 5 spots, and you can finish the last spot on the, actually on the occipital ridge. So I don't need to turn the head all the way to the side. I'm going to turn it only slightly to the side, and then just, my other hand, it's going to be a sattvic touch. I'm not really holding the head. I mean, should it turn, it will catch it, but it's just like an energy balance. Here I go underneath, and I'm going to do my body mechanics better, as you can still see me. I'm going to do circles on the back of the neck. Is that pressure okay for you? Or would you like more or less? And then I can release, feel for energy, and move on. Now, for any of these, should there be a tender spot or a painful spot, that's where you can do stop, hold with a sattvic touch, you know, for a little while, and then on the body, and then some off the body, and then check that spot again and see how it's doing, and maybe repeat it and see if there's any change. You don't have to keep doing it over and over. If there's a slight shift, that means the body's doing its job and it's shifting out. And if I'm still on the back of the neck. So this is a tamasic and rajasic touch together, because I'm doing a reasonable amount of, you know, deep, firm pressure, but not, in this case, at this moment, not super deep. It could be deeper. Now here I'm going to go a little deeper.